This Good to Go segment is sponsored by Spectrum Health Medical Group.
The COVID crisis has done a number on people with substance use disorders. According to the National Institute on Drug Abuse, researchers report increases in both substance use and drug overdoses in the U.S. since the pandemic began back in March of 2020. Doctors Colleen and Michael Vizachero are here they specialize in addiction medicine, I should say first, but they're here to talk about the help that is available at Spectrum Health. And it is good to have both of you here.
Thank you so much.
Thanks for having us.
It's great and so important that we're talking right now. The statistics really bear out that the pandemic has really created a hardship for people who are already struggling. Tell me a bit about Spectrum Health's addiction services. How can you help?
So at the Center for Integrative Medicine, which is Spectrum's addiction medicine clinic, we specialize in treating addiction. So just like the cardiologist specializes on the heart, we specialize in treating addictions. So we see anybody who's struggling with substance use disorders, and we have a comprehensive team of behavioral health specialists as well as medical providers that can care for them.
And what kind of services do you offer?
So we treat many types of substance use issues, primarily opiates and alcohol, because those require both a medical and a behavioral health component. So we really specialize in that, but a lot of our patients struggle with multiple substances. And so, we try to take care of that whole person when we see them.
Is there anything unique about the care that you provide at Spectrum?
Go ahead. Yes, sorry.
I was going to say, I really think that Spectrum has taken a unique approach. And we really try to focus on something called harm reduction, which is really, as Dr. Vizachero said, treating the patient as a whole person. What we're really focusing on is addiction as a chronic disease. So that means it's something that we treat over someone's lifetime. So really our focus is reducing all of the harms, potential harms that somebody could have living with a substance use disorder, whether that be a medical complication, a mental health complication. So really our job is to meet that person where they are in terms of their readiness, what they're willing to work on, and to really offer a comprehensive approach. So that harm reduction piece, that's something unique and that not every hospital system has embraced, and luckily we have that here at Spectrum.
We're fortunate to have it in our community. Okay, so the holidays are coming and a lot of families may not have seen each other because of the pandemic since last year or even before that, and they may see that they have a loved one who is dealing with some kind of an addiction or needing care. How do family and friends support people who are going through this kind of journey?
I think that's a great point. COVID has been isolating for all of us, and unfortunately addiction, by the nature of the type of disease that it is a disease of isolation. It tricks us into believing that we're the only ones dealing with this and that we should deal with it behind a closed door. So people have the opportunity, as we're getting together safely during the holidays, if you notice something, to really encourage that loved one to reach out to a trusted medical provider. At Spectrum, we're really trying to be a place where we can have these conversations, not only at the Center for Integrative Medicine as specialists, but at your primary care's office. A trusted person that you can go to and have the initial talk and say, hey, I'm struggling with the amount of alcohol I'm drinking, or I'm struggling with a substance. So that medical provider, that primary care doc is a great place to start.
And then for the family, encouraging that to happen, but then what about supporting them along the way?
So luckily, we're in a community where there is resources for not only the person or the patient dealing with substance use, but as you said, this is a family issue. It's something that touches everyone who's in that person's life. So we have behavioral health services through Network 180, through other community-based organizations, and at the Center for Integrative Medicine, as Mike was mentioning, or Dr. Vizachero was mentioning, we have a comprehensive approach. So we can refer families to those supportive services along with the patient.
All right. So important to seek help, get that conversation going so that folks are getting the help that they need. For more information, go to spectrumhealth.org and search addiction medicine. Thanks to both of you.
Thank you so much.
Thanks for having us.